Thanks, Shane, for allowing me to talk about my research. It's been a passion of mine for the last sort of 15 years to try and understand this issue of both what happens after a concussion, but more importantly, what is the long-term outcomes of those who play contact sports and what's the ongoing effects after they have retired. So very briefly, I'm a neurophysiologist. I have a adjunct or honorary research position at the Australian Sports Brain Bank, and I'm also an adjunct professor at Swinburne University in the Swinburne Neuroimaging Facility. I'm not a imaging person, but as I'll go through the presentation, I'm a physiologist. So I'll talk about the technique, which you can kind of see in the slide in front of you. I am self-funded, so I'm not a salaried academic at Swinburne nor at the Australian Sports Brain Bank. So for me to do my research, it's really important that I can get independent funding. So I know that Samantha Bureau from the Concussion Legacy Foundation has probably gone through CTE. So I'm obviously very aware not to go through all that again, but I'll just briefly want to touch on, I guess, where I come from in terms of understanding the physiology. We know that CTE is distinct from other dementias, particularly Alzheimer's, in that the pathology starts in the outer parts of the brain before spreading. So for me as a physiologist, I'm quite interested to understand that how does this pathology affect the physiology? Why is it that we see the behaviors we see in these athletes? Can we understand, and yet, I guess from a physiological perspective, what is happening? And so while it can only be diagnosed post-mortem in pathology, I'm hoping that we can understand the physiology in living people and can we move towards um, assessment, but also diagnosis. So this is the gold, I guess, uh, gold standard, the holy grail of trying to to understand CTE is whether we can progress to assessing and detecting CTE in living people, and possibly even having diagnosis of CTE with good confidence, because at present we're still relying on probable CTE, possible CTE, without the confidence that we have with other dementias. So at present, there is a criteria for, I guess, classifying people with traumatic encephalopathy syndrome, TES. At this stage, it's really important to note that it's for only research purposes. It's not used in clinical practice because we're still trying to marry up this criteria with the pathology post-mortem. So until we get more data, we can't use it for clinical practice, but hopefully we'll get there soon. As you can see, it's a multifactorial criteria, but one of the areas that still is lacking is a physiological marker to complement a number of these clinical features, um, level of functions, signs and symptoms. So, we really need to move beyond just clinical aspects and have support from physiological markers as well. So in talking about that, this is what I do as a neurophysiologist. I use a technique known as transcranial magnetic stimulation. It's not like the therapeutic version that some of you may have heard of, where they use TMS for treating depression. That is known as repetitive TMS, and that's a derivative of the technique that I use, which predates repetitive TMS. So this is I guess, a diagnostic research version that repetitive TMS then developed from. So very briefly, this is a video of what I do. It's only about 30 seconds. I will stop and start so you can see what I do. So what components there are is this machine here, which is the transcranial magnetic stimulator. It delivers a very powerful but very brief pulse of electricity. And you can see a coil here because it comes through to this coil, which is made of copper, and that creates a magnetic field. So that means that there is no pain because pain receptors do not pick up, um, magnetic fields. So what I do is I will record that pulse using electrodes, which I place over the muscle, but you can also place electrodes over the head to read the waveforms as well. I use a cap to help me guide where I need to place the coil. And as you can see, I place the coil over the top of the head, and that helps us deliver a waveform, which I'll explain now. So what we have is a schematic of the technique. So this is the coil, which is plastic covering the copper coil. So as I said, it creates a magnetic field which bypasses pain receptors. The stimulus can go through bone tissue if it's of a high enough stimulus, which sort of feels like a tap, really. It's nothing more than that. It'll depolarize or stimulate the nerve tissue, which we can then read using the electrodes. And we get a whole range of different types of waveforms depending on what how we stimulate, if it's a single pulse, if it's a paired pulse. And it gives us a good indication of what happens with uh, excitability of the brain. So that's the nerve tissue stimulating through the pulses, but also inhibition, which can actually stop the nerve impulses from happening as well. And that's really important on how our central nervous system works, is this balance between excitation and inhibition. So sort of just to quickly finish off, a couple of studies that have, really been, I guess, without, overstating it, my life's work for the last decade and a bit more, has been looking at retired athletes and the long-term effects. So this is one study that's taken almost a decade to come to fruition. I published this last year in the Journal of Neurological Sciences. It's a peer-reviewed scientific medical journal. And I looked at the effect of neurotrauma. So this wasn't about concussion. This was about the history of players from rugby, Australian football, soccer, with their exposure to repetitive impacts. So not, again, I guess we could say subconcussive or non-concussive impacts. And I tested players between the ages of 30 and 70 years of age, about 152 of them to be exact. And I compared to age-matched controls. So on this axis here is just that ratio between excitation and inhibition with those waveforms. And what we see with the lifespan is that over the course of the lifespan, you see this sort of alteration in the ratio becoming more inhibited as we age. And that's all part of healthy aging. But what we see with the retired athletes is that we don't see the same effect. And what we're seeing is almost a abnormal, and I don't mean to use that in a derogatory sense, but an abnormal excitability response. So it appears that a lot of the players have been, I guess, showing that their brains are more excited than what they should be for someone of a similar age. And this is more pronounced as the players age. And this may be a hint on why we see some of the signs and symptoms like irritability, aggression, impulsivity, because the brain seems to be more excited than what it should be. But that is something that we need to explore further. So that was one of the studies. I've got another study which I'll quickly talk about that relates to this, because one of the things that we're now starting to understand, which I'm hoping that Sam Bureau from the CLF has explained, is that it is not about concussion, but rather exposure to repetitive impacts. So rather than a history of concussions, it's the longer you play, maybe the position you play on the team will have a greater effect on your risk of CTE. And we're certainly seeing that with risk of abnormal physiology. So with that subgroup of 152 players, 113 of them were former professional athletes. So we were able to compare their professional career versus their total career from junior through to retirement. Because a lot of players in Australia, which I'm sure happens in New Zealand as well, is once they finish their professional career, they'll go back to their local club and play club footy for a number of years. So we were able to compare their total career to their professional career, because a lot of people think that this is based around elite sport or professional sport only, and what we're seeing is that it's the total career lifespan. So on this axis here, we have the years played, and obviously the total career is longer than the professional career. Again, on this axis is that balance between excitation and inhibition. And what we were seeing was that, and this is my mistake, that should be the wrong way around. We saw no significant change in the ratio over their professional career. But certainly, again, I've made a mistake there. My apologies. We were certainly seeing a correlation between the longer that they played and the changes in their excitability of the brain. So we're certainly seeing some uh, alterations that certainly need to be explored further. So to finish off, future directions is really about trying to work on that study line of inquiry further. We need to marry up the TMS technique that I use with other techniques, and we're hoping to get a study up using another technique known as magnetoencephalography, or MEG, to see if we can get a full brain picture rather than just the pathways. So that's certainly a project that needs to be funded and help us to maybe contribute to the traumatic encephalopathy syndrome criteria. And so, yeah, look, again, thank you for allowing me to talk, and I'm hoping that the Billy Guyton Foundation can raise a lot of awareness and a lot of funds to progress our research, and also for advocacy as well. I think that's really important to educate people in the wider community about the ability to play these games, but to play them safely. It's not about stopping the sport at all. It's about making sure that we have people who are enjoying their sport and enjoying for a long time, and also after their careers as well. So thank you very much. These are my contact details. I'm more than happy to respond to questions through my email. If you're on social media, this is my handle, LinkedIn as well. And if you want to see any of the other research papers, I've published about 260 research papers over my career, and continue to do so. Yeah, thank you very much again for having me.